Welcome. Today, in this part of this presentation, I will be talking about the ADHD and from a perspective of chronotype perspective. This will be the perspective I will adopt for ADHD because I will focus on etiology, symptom severity, and treatment of ADHD from a chronotypic perspective. This photo was taken during my wedding 9 years ago, and this is my husband. Why I am showing this to you is that I am sharing you with the fact that I only understood chronotypic type after I got married. He sleeps right away when he goes into the bed, and I pay attention to sleep hygiene. However, it takes me a long time to fall asleep. He sets his alarm and wakes up immediately, but I need several alarms to wake up. And when I call out to him, he wakes up, but when he calls out to me, I don't wake up. And I watched his family. His family is similar to that. They fall asleep when they go into the bed and they wake up very early. However, in my family, most of the members of my family go to bed late and wake up late. So there is a biological difference, I thought. And at that point, I was discussing my thesis topic with Ayşe, and this inspired me. I mean, my husband inspired me to choose my topic of thesis. I would like to thank him for that. And also, there are some common points. Maybe I can skip some parts of it because we have biological rhythms, circadian rhythms within this, and also a chronotype. What chronotype is, I will try to focus on that part a little bit more detailedly. And ADHD and chronotype relation is another topic I will talk about. And also in ADHD treatment, I will talk about chronotherapeutic treatment options. Since ancient times, we know that living creatures have a rhythm, biological rhythm, and this biological rhythm is affected by environmental conditions, and it is a cyclic one. As mentioned by the previous speaker, we have an inner rhythm and outer rhythm. Zeitgeber is the term we use it. It's the timer we have. And light is very important for circadian rhythm. Seasons of the year, lunar cycles, and state of the sun are also important factors that influence the biological rhythm. These are important environmental clues, and they have a cyclical effects. Biological rhythms, we will be talking about circadian rhythms. And circadian rhythms are actually rhythms with a period of close to 24 hours. Ultradian rhythms are shorter cycles than 24 hours. For instance, stages of sleep are among them. Peristaltic activity, hormonal pulses, and eating patterns. Infradian rhythms, these are cycles that are longer than 24 hours, and for instance, menstrual cycles are an example of this. Circadian rhythms, many organisms, not only in animals but also in other living creatures, living things, even those with one cell, single cell, they have an endogenous timing system, and that system synchronizes their physiology and behavior. And as mentioned by Ayşe previously, circa means about and DM means one day. So our inner clock is circadian, I mean about one day. Time is important because we cannot do everything at the same time. And we need to use time efficiently and our energy efficiently so that we can carry out all these activities throughout the day. So we do them in different times of the day. This actually shows us that there is the circadian rhythm and some peripheral rhythms. This circadian rhythm has two characteristics. They can oscillate in a period of approximately 24 hours, and it is an endogenous oscillation. And Zeitgeber are actually regulating the other factors. What does endogenous mean? If you put a living thing in an unregulated environment or fully regulated environment, this living creature will continue with its rhythm. But if there is light, this is the most important factor, the rhythm will be adjusted to 24 hours. As mentioned by the previous speakers, suprachiasmatic nucleus is actually the central pacemaker of our body, and all these biological circadian rhythms are carried out or using suprachiasmatic nucleus. I will be repeating here. With the light coming, melatonin is reduced, and with the reduction in light, there will be an increase in melatonin. So we have the sleep-wake cycle as a result, and all the other cycles. We have a master clock. We have the suprachiasmatic nucleus effective in this process, and also from all organs and tissues, there are stimulants going to our different parts of our body, and there are genes that actually regulate these stimulants, and they produce the proteins to regulate this process. As we have seen in the previous picture, there are many functions, and these are affected by the circadian rhythm: sleep, wakefulness, body temperature, hormone secretion, blood pressure, digestive secretions, levels of alertness and reaction times. These are biological factors affected by the circadian rhythm, and here you see the visual about this info. Of course, we have clock genes that actually adjust or regulate the circadian rhythm, and every living creature has this clock genes, and they do not have the minimum body temperature at the same time. They do not wake up at the same time, and not everybody has melatonin discharge at the very same time. So this is because of the heterogeneity among individuals, and these heterogeneity, these differences actually brings us to chronotype. Chronotype actually refers to the circadian choice of the person, the time he wants to choose to carry out the physical or mental activities is actually determined by the individual. And there are three types: morning type, intermediate type, and evening type. Individuals with the morningness chronotype, they prefer to sleep early and wake up early, and they carry out their physical activity or mental activity in the morning. But the eveningness chronotype go to bed late and wake up late, and they prefer the evening or the night time to carry out their activities. We have intermediate types. These are the nurture ones. They do not have a chronotype choice, so they do not have a specific choice of time to carry out their physical or mental activities. There are some factors that affect chronotypes. For instance, age. In young people, we see more morning chronotype. When we go to puberty, 14 or 12 or 14 years of age, people choose to be more eveningness type of chronotype. And when it comes to gender, we see that males are more evening chronotype when compared to women, according to the studies with large sample sizes. Puberty is important because there is a general tendency towards evening chronotype, and this is affected by the hormones. The same thing applies to the menopause, especially after menopause or with the menopause. You would go towards the morning chronotype, and latitude and cultural background are important. And in the Mediterranean region, people are mostly more evening chronotype, and birth season is also affecting here, especially in males. If they were born in winter, they will be more morning type when compared to those who were born in the summer, and they actually correlated this with the length of the day during this season. I'm telling you all about this vibe because we have evening chronotype, and having an evening chronotype is a risk factor for physical and mental health. It is a non-specific risk factor, and as mentioned by Ayşe, both physical and psychiatric diseases have correlation with this, starting from reproductive issues up to cancer if you have an evening chronotype. And many psychiatric diseases are also correlated with this evening chronotype. There are lots of studies about depression and suicidal ideation, substance abuse, internet addiction, daytime sleepiness. These are all the diseases that are correlated with the evening type, and there are many studies about them. When it comes to the morning chronotype, we know that it is mostly protective, both in terms of physical health and mental health. Now let's focus on ADHD and chronotype. For children, adolescents, and adults, there are many studies, and in those studies, it is found out that ADHD people have a tendency to become an evening chronotype, or vice versa. Evening chronotype actually are more disruptive in their behavior, and in multiple sleep latency tests, daytime sleepiness is higher in individuals with ADHD than the control group, and while children with ADHD were sleepier throughout the day, the highest sleepiness was observed in the morning hours, and these findings are associated with the delayed circadian rhythm in ADHD. This is the study shown by Ayşe previously, and in this study we have two groups. Healthy group with 52 children between the ages of 7 and 12, and again ADHD group, 52 patients with no other psychiatric problems, and we compared these two arms in terms of chronotype. And in ADHD group, chronotype total points is much higher, and they are most of the time evening people. And in children, we do not have many studies about this. And Gruber's study is there, and also ours followed it. And most of the time, you see the chronotypic distribution. The darker one, dark purple one, is the evening group. In the ADHD group, it is 36%, and in the control group, it's 25%. And in the ADHD group, the morning type is 5.8%, and in control group is 20%. So these are children between the ages 7 and 12. And here, I will focus on another point because I focused on its relation with the sleep disorders. And in ADHD group, when we analyze it based on the chronotypes, we check the sleep disorders and we checked it whether there is sleep disorder or not. This is the classification. And here, I need to use my pointer if you help me. This is the ADHD evening chronotype group, and 100% of them had sleep disorders, and ADHD morning chronotype group had 33%. And we see that with the evening chronotype, we see a higher level of sleep disorders in ADHD patients. There is another adolescent study which is to be published soon, and in this study, it was found that actually, we made a comparison between the control group and the ADHD group, and we know that ADHD group is closer to the evening chronotype, and we made a comparison here, and we also divided the ADHD group into two subtypes, morning and evening chronotypes, and morning ADHD and evening ADHD groups were compared in terms of sleep disorders and symptom severity. These patients were between the ages of 13 to 18, and 76 of them were diagnosed with ADHD, and 122 healthy controls were also involved. And what is striking here is that there are differences between the groups in terms of the eveningness chronotype. In the ADHD group, we see a higher increase in the evening chronotype, and in the control group, in the ADHD group, only morning chronotype level is much lower in the ADHD group, and in the control group it is much higher. So here you see the sociodemographic data of the ADHD group. So they match in every variable, and morning and evening ADHD was compared, and there are differences in all fields. For instance, ADHD symptom severity is much higher in the eveningness group, and also in impulsivity, hyperactivity, learning problems, anxiety, psychosomatic symptoms, and especially for the 7 and 12 ages group, there are more sleep disorders, and we see that in terms of total score, eveningness ADHD group is doing worse when compared to the control group. And here we should focus on the final part, the last part, in terms of correlation, because we have CCQ total score. This is the eveningness score, and if we increase the eveningness score, then we see an increase in the ADHD symptom severity, an increase in the resistance to going to bed, and also there is an increase in delay of falling asleep, and there is more anxiety during the sleep, and there is more sleepiness during the day, and the total score is also much higher in terms of sleep disorders. And we see that there's a correlation between the sleep disorder point scores and also eveningness chronotype score. I believe that this is an important table. What we are trying to do here is that we know that sleep disorders are higher in eveningness chronotype. So, is it effective on the symptom severity, and could it be because of its comorbidity with the sleep disorders, or is it related? Being eveningness person is related about the symptom severity. And when we look at the scores for the second step, again we have seen some similar results, and regardless of the sleep disorders, if there is eveningness, and if there is an increase in eveningness chronotype, it also increases symptom severity. So we can say that it may be independent of the sleep disorder. So why do we have eveningness in ADHD at a higher level? Because there are some trials, some studies carried out. For instance, D4 receptor genes we have, and this is one of the problematic genes in ADHD. It has a polymorphism, and the gene polymorphism here also affects the circadian clock we have, and also polymorphism in clock genes is another factor. Neurokinin 1 receptor deficiency, neurotransmitter system, the neurotransmitter system causes noradrenergic hypertonic discharge, and with this tonic discharge from the pineal gland, we see a late or delayed release of melatonin, and this is an impaired system in ADHD, and this is why we see such an impairment in the circadian clock. And a pineal gland volume is decreased in ADHD people when compared to those without ADHD. The trials have shown us that. So, why is it related with the symptom severity? Let me focus on that part. There could be a common or shared etiopathogenesis. It may increase sleep, daytime sleepiness. It may be caused by social jet lag. And in chronotherapy, I believe that chronotherapeutic approaches are very important in ADHD, and chronotherapeutic approaches may be added to the ADHD treatment. This is actually investigated in the literature, and there is a study about agomelatine, and if you give agomelatine to the ADHD group, then the ADHD scores are found to have reduced according to the study. And again, in this study, we see that in all the subscales, there is an improvement with agomelatine, a significant improvement with agomelatine. And again, chronotherapeutic treatment approaches include light therapy as well. And if you give light therapy, ADHD symptom severity is reduced according to this trial. Another study shows us that melatonin can be given to ADHD group patients, and there is an improvement in ADHD symptoms. And this is a case report, but again, light therapy is given to an ADHD case, and delayed sleep phase was normalized, turned to normal, and the ADHD symptoms were reduced. So, chronotherapeutic strategies are very important, and sleep hygiene is very important, and we should have sufficient hydration throughout the day, and we should have as much time as possible in bright sunlight, and we should avoid caffeine in the afternoon. We should regularly exercise, and this exercise should ideally be before 6 p.m. And if there's any problem, we can support the patient with melatonin. As mentioned by Ayşe, actually the blue light actually impairs the melatonin release, and we should stop eating 3 or 4 hours before bed, and the ideal time for bed is 9 or 10 p.m. and between 10 p.m. and 2 a.m. in the morning we can have the most restorative sleep. Physical activity is very important, and for physical activity, light and feeding schedules, these are all affecting suprachiasmatic nucleus and its release of melatonin. And people with ADHD can be differentiated by their chronotypes, morningness, intermediate or eveningness types, and we can help them use the times when they are more effective and efficient. Melatonin can be supplemented, and anadrol therapy can be given. And also for the eveningless chronotype, we can use this as a screening tool for the ADHD patients. Thank you very much for your attention.